substances, the benzodiazepines, sedatives, stimulants, opioids that Dr. Schaefer had mentioned. One of the other things that the Bangor community is really committed to doing is expanding the medication-assisted treatment, and in fact, Vanessa with the Maine Primary Care Association mentioned that there's only 4 entities who had applied for a really large MAT expansion grant. PCHC is one of those, and we've partnered with a number of other entities in our community. Again, making Bangor a really nicely positioned town to be able to launch a social detox program, as Dr. Schaefer had outlined. One of the other things that we're doing in the Bangor area is planning to implement a Suboxone program at our homeless health center, the Hope House Health Center. We're planning to do that actually in the winter of 2016. So that'll include not just Suboxone, as Dr. Schaefer commented. Suboxone is not a magic wand. You must also have treatment that goes along with that, and that is our plan to do that. I do see that I'm out of time. I wanted to answer some questions about the PMP and make some suggestions on how long waiting lists are for detox. I'm out of time for that. I would maybe suggest one of the senators or representatives, I don't remember who, had asked how long the wait list is for detox. And I guess I would recommend that actually the best places to get that information are from the emergency departments, because the emergency departments, unfortunately, in our state, is where people go when they're seeking detox and where they will sit for hours, days at a time, or be discharged when they're stable enough home back to the community with really no recovery process in place. So I'm happy to answer any questions if there are any.
We would welcome additional information. So if you would like to send an email through to our clerk with that additional information, we would be very pleased to have that.
Absolutely.
And we will be working this building in the next few days. So if you can do that within the next 24 hours, that would be great.
Yep, I can absolutely do that.
Good. Thank you.
Thank you for all 3 committees.
Oh, absolutely, yes, and that will go with all 3 committees. But if you send it to our clerk, if you send it to Mary Ann, she will get it out.
That's very convenient, thank you.
Yeah. Okay, thank you very much for the,
Thank you.
appreciate it. Dr. Dowd? Welcome.
Hi, thank you for having me here. Last time I was here, I was handing out instructions. This time it's cookies, you'll be happy to hear.
Thank you, that's very kind of you. 5 o'clock in the afternoon, this is just what the committee's meeting. Thank you very, very much.
So, my name is Dr. Mary Dowd. I am the medical director at Milestone Foundation. I also work at Catholic Charities and Discovery House, which is a methadone clinic. There has been some controversy in the news lately about how to spend the funding for addiction treatment, so I want to address 3 points. One is medication. Without funding for medication, nothing will change. With methadone or buprenorphine, 80% of patients recover, go to work, pay their bills, raise their families. Without it, 80% relapse, even after years of sober living. With counseling and rehab alone, 80% relapse. With detox alone, 95% relapse. These numbers are based on years of experience with methadone and Suboxone treatment. Medication is a cornerstone of treatment. Without it, everything else collapses. And there's an article in your packet you can look at. Number 2, detox is necessary. Not for everyone. For patients who have sober supports, a home, job, insurance, can start Suboxone in the office or enroll in a methadone clinic and do well. This is not the patient I see at Milestone. Heroin is a destroyer. The young men and women I see there are homeless. All their worldly possessions fit into a filthy, threadbare backpack. They sleep at the shelter or in the woods or in a doorway. If they've been lucky enough to have a caring family, they've torn it apart, bankrupted it, destroyed all trust, burned all bridges. Let's pretend these patients have insurance. If medicine were all they needed to get better, we could close Milestone down, and I could wander up and down Preble Street handing out prescriptions. Absurd, yes. I can't do that, and I wouldn't be comfortable having a homeless heroin addict whom I've never seen before and who likely has cocaine, Klonopin, bath salts, amphetamine, and alcohol on board, as well as heroin, walk into my office and walk out with a prescription for Suboxone, another narcotic. My point is this: heroin addicts don't have homes, they don't have doctors, 90% of them are abusing other substances as well. And opiate withdrawal is the worst flu you ever had, raised to the 10th power. In detox, these symptoms can be treated. Patients can start to think clearly for the first time in years. If treatment were available, they could be referred out with a bridge prescription to keep them from relapsing until they see their new doctor. Detox is where the process of transformation begins for these patients. Without medically assisted treatment, it is where it ends as well. What about rehab, counseling, sober housing? By the time I see a patient at Milestone, they've been using for 8, 10, or even 20 years or more. The average heroin addict seeks help after 15 years of use. Since 2008, I've been blessed to have an OSA grant that funds treatment for a handful of homeless opiate addicts. When I start one of these patients on Suboxone, we both have high hopes it will change their lives. And it does, it can, but only for the ones who find sober housing and get intensive counseling to teach them new ways to cope with stress and trauma that drives them to use. It's not possible to change the habits of what amounts to a lifetime of use for these young patients with just medication alone. At Milestone, we do about 20 opiate admissions a week. A third of these patients I know well. I've seen them before. I'll see them again and again. They're desperate to quit. Without medication, they have no recourse but to return over and over again. This is tragic, but what is truly alarming is the other two-thirds, the ones I've never seen before, a dozen or more new heroin patients every week arriving at our door. These young men and women are Maine's future. They need medicine and counseling and structured sober living. Thank you.
Thank you, there is a question. Representative.
Thank you, Doctor. I know this would be an estimate, but what percentage would you say come from outside Penobscot County?
I don't know the answer to that. I work in Cumberland County.
Well, let me reverse it. How many people do not come from Cumberland County and end up in your facility?
Oh, a lot. They come from all over Maine. We're the only detox around.
So
Probably, I guess a half. That'd be my guess.
thank you.
Other questions? Thank you very much, Dr. Becker. And thank you again for the comments. Tatiana? Here. Chris Paulus? And then Liz Luther, and then Alan Newman Merrill, and then Bob Howe. Welcome.
Thank you, members, chairs, for making this an issue of attention for the legislation. My name is Christopher Poulos. I'm honored to be here. I was born and raised in Portland, Maine, and I think I'll actually start with a quote from a criminal justice reform warrior. The quote is, "We used to incarcerate people because we were afraid of them. We used to arrest and incarcerate people because we were afraid of them. We do it now when we're simply mad or frustrated with them." And that's from none other than Newt Gingrich. And that speaks to the bipartisan nature of the issue at hand. I'm currently in my final semester of law school at the University of Maine School of Law. where I served as president of the American Constitution Society. I've been a member of multiple task forces at the local, state, and federal level whose missions involve addressing criminal justice policy, addiction, and recovery. I'm also a sworn officer of the court and member of the Maine Bar with the right to practice law as a student attorney and regularly represent juveniles facing criminal charges. Guess what percentage of my clients have a charge that somehow involves the misuse of substances, whether the actual charge or the underlying cause? 100% so far. Guess how many enter the criminal justice system, don't receive additional services, and are somehow magically cured from that process? Unfortunately, none. That's what I've seen to be my experience. I'm also a person in long-term recovery from addiction myself, and I'm a member of the advocacy organization, Young People in Recovery. I'd ask that any members or supporters of Young People in Recovery please stand and show your support. A new approach to the war on drugs is unfolding across our nation. One of the ways that Young People in Recovery is supporting this new approach is by connecting people in recovery with other people, or connecting people in recovery with people who are seeking recovery. And that's been essential. So while the detox, treatment, everything is all key, I could not overcome my own addiction until someone else who had overcome their addiction reached out their hand and showed me how. So I hope that that's a key part of the Portland Community Recovery Center, which is funded by MASAP, and that's why it's all connected to what we're doing here today. The new approach to the war on drugs has been learned over the last several decades. We have learned through experience that we cannot arrest and incarcerate our way out of this problem, and that a jail cell in and of itself does not provide treatment for the health condition of addiction. My journey in recovery has brought me from homelessness and incarceration to law school and the White House. Most importantly, my recovery has allowed me to become a productive member of my community and a member of my family. Thank God, when I decided to seek help for my addiction, I had health insurance and I had a supportive family, because without it, I don't know that I would be alive today. Many of my friends are not. My message today is very simple. I do not object to hiring additional agents. However, we could hire 500 additional agents. If we don't address the underlying issues of substance use disorders, it will be to little avail. A balanced and comprehensive approach is needed, which emphasizes both supply reduction and demand reduction. And I believe that it is necessary now. I've heard that there are concerns that treatment does not work, that people do not recover. We stand here together as one today to challenge those beliefs. We are living proof that treatment works and recovery is possible. We need the resources and support necessary to address this public health crisis in an effective and compassionate manner. We are worth saving. Thank you for your consideration.
And we thank you very much for being here today, and we also appreciate the presence of others who are involved in young people in recovery.
Great.
So thank you for your comments.
Any questions? Thank you.
Thank you very much. Liz Ruthner?
Good afternoon.
Good afternoon.
This is my first time ever in this building.
Well, we're glad you're here.
Thank you.
You're welcome.
How are those cookies?
Yeah.
Pretty good from over there.
I know it isn't the need to be eating in front of the audience.
It's just a testament of how important it is to us that we're all still here, right? So thank you all who are still here with us. My name is Liz Luthner, and I'm a resident of Portland. I'm here today as a private citizen to speak in favor of the proposed targeted comprehensive approach to address the state's drug crisis. I too am a person in long-term recovery. I've recovered from addiction. My sobriety date is February 2nd, 2011. Groundhog Day. That's coming up on 5 years. It'll be 5 years next month, God willing. And one of the fortunate ones. 5 years ago, I was desperately in need of help. I felt I'd never be able to recover from addiction. It was the darkest time of my life. But I had access to detox, and I managed to scrape up, with the help of my family, enough money to pay for treatment. If I hadn't gone to treatment, I'd be dead. It's as simple as that for a lot of us. It's very simple. 5 years ago, I was hopeless. But when I entered treatment, the people there helped me touch a place of hope that still lived in me when everything else seemed dead. The people who helped me had once been just as hopeless as I was, but they were well. They were recovered, and they helped save my life. In treatment, I not only learned what the disease of addiction is, I learned what recovery is. But that's why access to treatment is imperative for everybody. In treatment, I learned how to break the cycle of addiction, and we've heard so many stories today. In the end, our stories are all the same, that we wanted to stop and we couldn't stop. And I learned how there to recover, how to cultivate healthy practices for body, mind, and spirit, how to begin to take the steps that would lead to sustainable long-term recovery, how to live a life that makes sense. Every addict trying to get better should have the same chance to recover that I have, which is why I'm asking you today to please pass LR 2599. I know that recovery is possible because I see it in others every day. Today, I coordinate recovery and wellness programs for Hope Acts, a Portland nonprofit. We work with Maine's recovery community and also the asylum-seeking immigrant community. I work for Hope Gateway, a United Methodist church in Portland, where I'm privileged to lead yoga classes for our incredibly inspiring recovery community, people just like me. Recovery is possible. Anything is possible. But none of this would have been possible if I did not have access to help when I was so desperate for it. None of this, nothing seemed possible, nothing at all 5 years ago, before I entered treatment. And as I said, I was fortunate, really fortunate. But economics can't be the deciding factor when human lives are on the line. And they are. We've heard so many stories today. This is a crisis. We all know that. People are dying. We know that. We know people who are dying. Our friends and our family members, they're dying. Right here in Maine, lives are at stake, and you have the opportunity to offer hope to the hopeless by making detox and treatment and recovery available to all. I urge you all to swiftly act and pass this bill. The lives of Mainers depend on it. Thank you.
And we thank you for being here today. Thanks very much. Alan Ewing Merrill, and then Bob Howe, and then Glenn Lewis. Welcome.
Thank you. My name is Reverend Alan Ewing Merrill. I serve as pastor of Hope Gateway, which is a United Methodist Church in Portland, and is executive director of Hope Acts, a 501c3 nonprofit with a non-religious mission to support persons in recovery from addiction. I also serve as the vice president of the Maine Council of Churches, although I'm not here today to speak on behalf of the council. I'm here today as a member of the clergy and as a nonprofit leader. I was born and raised in Maine. I care about Maine. I am a taxpayer. And especially I'm here today because I consider myself a recovery ally. I don't know the pain of addiction from firsthand experience, but I am a friend and a cheerleader and a supporter of many who have battled addiction and today are pursuing a hopeful life of recovery. I'm wearing a sticker right now that says, recovery is possible. Anything is possible. And I believe that. I've come to believe that through my experiences as I've gotten to know and hear the stories of so many in recovery from addiction. As a state, we can do a far better job of providing access to essential treatment programs that offer hope and healing. In a typical week, more than 300 people walk through the doors of Hope Gateway to find support for their journey of recovery. Most of them are young adults in their 20s and 30s, and they are some of the most remarkable people I have ever met. They walk through our doors to attend 12-step meetings, or to take part in recovery yoga, or to participate in a meditation gathering, or a drumming circle, or some other kind of support group, or to meet with a sponsor, someone a little further down the road of recovery who provides both support and accountability. Here's the amazing thing. They aren't just sober. They aren't just hanging on by their fingernails, hoping and praying for another day without a drink or a drug. They are solid and secure individuals who have experienced tremendous pain and suffering, but who today are full of hope. They are well. They are actively pursuing a life of wholeness. Some of them are students at our universities and community colleges. Some of them are contributing to our economy as members of the workforce. Pretty much all of them across the board are volunteering their time as a way of giving back. Many of them are providing peer support for others who are newer on the journey of recovery. And don't miss this important fact. Almost all of them required some kind of detox or treatment program in their earliest days of recovery. Some of them have told me that without access to treatment, they probably wouldn't be alive today. I share all this because I think there are so many misconceptions and stereotypes about addiction and recovery. I hope that some of the stories you've heard today have dispelled some of those misconceptions and clarified some of those stereotypes. Some of the people I admire and respect most in the world are people in recovery from addiction. We must increase access to treatment programs, not only for the privileged few who have insurance or financial means on their own, but for all who are struggling and desiring a life of recovery. Addiction is nothing short of a public health crisis in the state. It tears apart families and communities, and it knows no socioeconomic boundaries. When our friends and neighbors are suffering and pleading for treatment, we cannot turn our backs on them. I've said this before in this room, but let me just remind you again, as a religious leader, that a budget is a moral document. The decisions that you will make in the days ahead have moral and ethical implications. These are not just matters of dollars and cents. The things that we fund and the things we decline to fund speak volumes about the values we hold and about who we are as a state and who we long to be. And so I urge you to make the right and just and compassionate decision. Do all that you can to support substance abuse treatment and increase access to it. Expanding options today will serve our state well as an investment in long-term health and well-being of individuals and communities throughout the state of Maine. Thank you.
Thank you very much, Reverend Merrill. So no questions. Thank you for your testimony. Thank you for your testimony. Glenn Lewis, and then Aaron Price, and then Nico.
Hi, thank
Good
you all.
afternoon.
Yeah, good afternoon. Thank you all for staying so late. Excuse me. Something I want to touch on here. I'm also a recovering addict after this has been 20 years plus for me. I went through the Addiction Resource Center down in the Bath area 20-odd years ago and had success through that. It was a conjunction of things that I had for a support network that were effective through AA meetings, through NA meetings, through therapy and so forth. That worked very well for me. But over the course of about 6 years, I developed a condition that's called syringomyelia. It was treated with pharmaceuticals. I started, on benzodiazepam. It started with a recommendation of Neurontin. One medication led to another. Before I knew it, I was addicted to pharmaceuticals, although taking my prescriptions exactly as guided by my doctor. Now, one of the things that happened was in the natural progression of that was the move towards opiates, stronger and stronger things. I had side effects that led me to believe that it was my neurological condition. not the drugs that I was taking that my doctors were prescribing. Some time went by. We passed the 1999 medical marijuana law. A friend of mine advised me that there was some benefit to me looking at that as a way to get off some of the pharmaceuticals that I was on. I thought it was nuts. I wouldn't even begin to go there. I'd come from a very bad place in my life, coming through recovery. I didn't want to ever go back to that. So to consider medical marijuana as a medicine was the furthest thing that I could even imagine. What happened, though, was I started using it, and I was going to medical rehab. They knew well that I was using this as in conjunction with my medicine. I didn't want the opiates. They didn't work for me, and I knew where that would go. Over a course of a while, I worked with a guy with tinctures and things like that, with medical marijuana. I was able to reduce my intake of pharmaceuticals almost in half immediately. It took some time. It didn't happen overnight. Now I'm in a place of where I actually help people get off the same pharmaceuticals that our doctors are prescribing. What happens, though, is a lot of these people are dumped off that system, and they go to the street, and the next thing you know, they're taking heroin or something that's a little harder. So as we move ahead, I just want you guys to remember that we have voted in this state as marijuana is a medicine. It's effective. I've seen it firsthand. I've seen addicts use it as a medicine and come through it. So please, as you move forward, there's all sorts of things that we heard here today, all sorts of different recovery programs, but there are also people that have to use medical marijuana as a medicine. A lot of the recovery programs do not support that at all. So education is out there. And for me, I had to look the stuff up. I had to go after the information to support my decision to use medical marijuana as a medicine in the first place. So thank you for your time, and hopefully you can consider that and move forward in a positive fashion.
Thank you very much, Mr. Lewis, for being here today. Aaron Price, and then Amy Bernard. Welcome.
Hi. Thank you to everyone who shared before me. I think it'll exponentially help moving forward with this bill. My name is Aaron Price, and I'm 15 years old. The fact I can stand here in front of you today is evidence of the biggest lesson learned while in treatment at day one for my heroin use. That lesson being that secrets keep you safe. I went to great lengths to keep all my secrets inside. No one could have imagined the freshman girl on student council with tremendous grades spent most of her time in the girls' bathroom snorting heroin while planning ways to get more. I thought I could balance honor roll and my need to escape from my secrets. However, it started to become impossible to juggle the two. Heroin was my only focus. My values, my grades, and my relationships no longer mattered. I loved the feeling of being temporarily free from all of those secrets. When I first got to treatment, I was determined to keep the secrets I held on to for so long locked up. But then in trying to fake my way through and being defiant, I was caught on social media. For those who don't know what it's like to be in rehab, that's a huge no-no. I couldn't envision someone sitting down with me and addressing my behavior without blaming, shaming, or screaming at me. It was from this point on, if I wanted something different, I needed to do something different. I began opening up about my secrets, witnessing domestic violence, my role within family addiction, and having been a victim of sexual abuse. It was through family mediation and individual sessions with my counselor, Amy Reynolds, that I unloaded all of my secrets to my mother in a way I thought I never could. It is because of treatment I learned to love and accept myself. It was very uncomfortable at first to actually work on myself in my life. I've realized it seems the days I sit being uncomfortable are the days I learn the most about myself. It is because of day one I will remember these two lessons. Number one, that secrets keep you safe. And two, if you do what you've always done, you'll get what you've always got. I hope everyone struggling with addiction can get to learn these lessons and have someone like Amy who saw potential in me when I couldn't see it in myself due to my addiction to heroin. Thank you for giving me an opportunity to get more of these secrets out. Addiction can get the best of anyone. Could be a person like me with a sturdy life, courteous personality, and superior grades that can be yanked away within minutes due to addiction. With that being said, anyone should be able to get a chance in the best of treatment. I am so grateful I have regained things I have lost, because I was one of the girls that was able to receive 1 out of the 6 beds available in the state of Maine for adolescent females. I encourage you to help those who are still fighting heroin addiction that feel as I do today, that I is finally hopeful and proud. Thank you.
And we thank you for your courage in coming before us today, and we wish you all the best in continuing to build a really bright future for yourself.
Thank you.
Thank you. Amy? Good afternoon.
Good evening to all of you. Good afternoon, welcome back, Happy New Year. My name is Amy Gallant and I'm the Advocacy Director with AARP Maine. AARP is an organization representing 230,000 members, 50 plus in Maine and their families. We're a non-profit, nonpartisan member organization. And we are a member of the Cover Maine Now Coalition. And today I'm testifying on behalf of the Cover Maine Now Coalition. The coalition is a group of over 100 Maine-based organizations representing medical professionals, faith groups, health and low-income advocacy groups, federally qualified health centers, and others who support accepting federal funds set aside for Maine to provide health coverage for people with low income in our state. I've attached a list of the Cover Maine Now Coalition members. Cover Maine Now supports this bill and applauds legislative leadership and other stakeholders for coming together to develop a bipartisan proposal that takes a step in the right direction. The coalition sees this proposal as a good first step in combating the drug crisis in Maine. We also believe that by taking this first step, you have an opportunity to commit to working together to develop a more comprehensive proposal that would cost-effectively provide access to much broader and effective drug and mental health treatment over time. While the proposal in front of us today is comprehensive in its approach, we want to remind you that resources are available to Maine that would provide comprehensive, ongoing drug treatment services to Maine's uninsured. We still have the ability to accept federal funds set aside for our state to provide comprehensive health insurance coverage to people with low income in our state. Comprehensive solutions to and treatment for substance abuse and mental illness are critical for Mainers of all ages. Mainers over 50 may be struggling with their own use or illness, or that of their children or grandchildren. AARP Maine continues to advocate for the health and safety of those with very low incomes between the ages of 50 and 64 who are neither eligible for Medicare nor for subsidies in the health insurance marketplace. On a more personal note, a former colleague who was a peer support worker for others in recovery lost his battle quite unexpectedly with addiction just a few weeks ago. He was clean for as long as I had known him, and just a few weeks ago we got the very shocking news via Facebook that he lost his battle after one relapse. Some of you may remember him among the many who testified before the HHS committee last session in support of expansion, specifically to provide support for uninsured veterans with mental illness. Last April 30th, David shared with the committee the following, quote, "No veterans should have to sleep in a shelter because they are too sick for work. No veterans' families should face eviction because healthcare costs have bankrupted them. We need to show our veterans that, regardless of their economic status, they are not forgotten." If my friend David was here today, I'm sure he would not mind me adding to his sentiment. We need to show our veterans and all Mainers that, regardless of their economic status, their mental illness, or their substance abuse, they are not forgotten. Thank you. I'm happy to take any questions.
Thank you. Questions, committee? Thanks again. Is Jane Harmon? I know she spoke early on the first part, and then Matthew Brown. He spoke earlier, okay. Next up, Barbara Royal.
Good afternoon.
Good afternoon.
Thank you for staying and being so committed. I am the director of a treatment center in Ellsworth called Open Door Recovery Center. And I am also in the process of opening another facility that's attached to us called Hills House, which is a treatment center for women who are pregnant or have a baby up to age 5. In previous years, we were open, privately funded. Unfortunately, after 4 years lost, the private donations dwindled out. We had 30 women go through that program at the time, and several babies and so on. Well, with a grant, we now have, over the past year and a half, built an addition onto that building. We now have doubled our capacity. And long story short, the building is now completely ready, and we have a license pending from DHHS. And just wanted to preface my testimony with that, just so that you understand a little more about what brought me here today. At Open Door, we treat a multitude of clients from very different lifestyles and backgrounds. We have 2 adult treatment drug courts, one in Comstock County, one in Hancock County. We've been providing substance abuse treatment in Hancock County Jail for over a decade now inside. We have intensive outpatient treatment, we work with families, and we are also in 4 different school systems providing treatment for adolescents. I will attempt to carry a message from many voices of individuals who are not always able to speak on their own behalf. This message comes from what we at Open Door refer to as the front line. It is where men, women, and children are haunted daily by the voice of